Hi everyone, welcome back to Therapy Tip Tuesday. My name is Amanda, as you all know already, and today I will be sharing a very interesting therapy tip about voice. Voice is an area in speech language pathology that you might not always think of when you think of our field, but it is definitely an important one. So there are a variety of different types of voice disorders, including functional voice disorders, neurologically based voice disorders, as well as organically based voice disorders. You might be surprised to find that a lot of kids actually do experience voice disorders. And one of the most common voice disorders that we see in kids is a hyperfunctional voice disorder, otherwise known as muscle tension dysphonia. And with this disorder, the muscles around our larynx, which is over here in our throat, and our vocal folds are overexerted or too tightly constricted to the point where it changes the actual sound of our voice. So sometimes it could sound strained, or it could even sound a little breathy. But at the end of the day, we know that there's too much stress being put on the vocal folds and they need to rest. So our larynx, a little better picture here, is the part of our throat where our vocal cords lie. And this consists of many different muscles that help contribute to our ability to speak. And as we all probably know, if we just put a finger over here on our throat will vibrate when we are speaking. However, when we overexert our vocal folds and the muscles in our larynx, we experience changes in our voice. For example, if you've ever experienced laryngitis, that's when we have a very breathy sounding voice because we put way too much stress and pressure and tension in our throat that our vocal folds are having trouble vibrating. So again, like I was saying, it is very common for children because of the activities that they usually engage in, whether it's in person, on the playground, during sports, or playing video games. It's very common to see children yelling and screaming and getting excited. So I do have some helpful hints and exercises for you just in case you start to notice any signs that your child's voice doesn't sound as it normally does. Maybe it's a little bit breathy, maybe it's a little bit strained sounding. But I have some tips for you to use with your child to help them heal, give their voice a little bit of a rest, and make sure that they recover and practice good vocal hygiene. So the first one, and the most easy one actually, is to identify any negative or poor vocal habits. So kind of going off what we were talking about, when this type of voice disorder is brought to a speech pathologist's attention or an ENT, if it gets to the point where it forms a vocal nodule, they'll usually ask you, what type of vocal habits do you or your child exhibit in a day? So are you yelling at all? What is your occupation? Do you have to spend prolonged periods of time speaking at a higher volume? And then once you list out all the different things that you do that can contribute to a change in your voice, you can then modify those things. You could change them. You could see if you could not engage in them if it's possible. So for example, if you notice your child has a different sound in their voice, but you also know that they're constantly yelling on the playground and they're just normally a very loud speaker, then changing their vocal habits so they limit their time projecting their voice on the playground, and also giving them cues and providing them with just some hints to lower the volume and remember like how close in proximity we are. We don't need to yell. Let's use our inside voices. Let's give our voice a break, whatever we have to say. That will be very helpful in helping to heal and give our larynx and our vocal cords a break. Something else super easy is to stay hydrated. And I know we have to stay hydrated anyway. We should all be drinking water because water is the best and it helps with everything. But it actually also helps to keep our vocal cords in their best, most optimal condition for speaking. So the more water you drink, the better. Another one that could be a little tricky, especially for our kids who really like to talk and tell their stories and get really excited and want to share things with us, is vocal rest. So you can see how it can be a little bit tricky because you really do and should encourage your child to relax and give their voice a break if it's possible, and trying not to engage in over stimulating their vocal cords just by maybe listening. And I know it's so hard, but when you're trying to work on repairing and healing this part of your body that you know is so important in being able to communicate, those couple of days or maybe a week just to limit the amount that they speak could be really helpful. Another tip that I have is called diaphragmatic breathing. You've probably, or you maybe have heard of it through yoga practice, but it's actually really great. It's a great practice to start, even if you don't have any voice issues, because by using diaphragmatic breathing, or belly breathing, I was going to say, we are able to increase the amount of air we take into our lungs. So instead of chest breathing, we breathe out through our belly. So typically, I think most people chest breathe, and when someone chest breathes, you can see their shoulders and some clavicular movement going on. So here's an example. So you can see that my shoulders increase in height, my chest puffed out, and my whole body kind of raised with me. But when we breathe through our belly, our diaphragm pulls down more, and our lungs are able to take in much more air. And when we take in more air, we actually put less strain and stress on our larynx. I know everything goes back to the larynx and the vocal folds, but it's true. If you think about it and you're trying to speak on an insufficient amount of air, you will wind up straining your vocal folds because more effort is going into the muscles rather than it should be going into just having enough breath. All right, that is the end of another Therapy Tip Tuesday. And I realize that I gave you a bunch of tips today instead of just the one, but it's always a good thing, right? All right, everyone, have a lovely day, and hopefully this was helpful and can help you or your child if you're experiencing any difficulty or any noticeable changes in your voice. All right, bye.